Maharashtra has seen 37,000 COVID positive cases till now, and of these 17,000 have actually been discharged. So the active cases stand somewhere around 20,000 right now, and yet this is a point of concern because within 15 days Maharashtra will go in for monsoons, and the risk of other infections like dengue, malaria also increases at that point of time. One of the most important things, that's why, is the availability of beds in most of the major COVID red zones like Mumbai, Pune and Nashik, Aurangabad, etc. What we are being told right now is that the state has decided to set up a dashboard. At least the Mumbai Municipal Corporation will have this dashboard, which will have the combined strength of the private and the public hospital beds that are available to people at that particular point of time. This dashboard is going to be operational sometime this week is what we are being told. Meanwhile, the MMRDA BKC facility that was created as a temporary hospital with 1,000 beds has already been taken over. The other aspect, of course, is taking over 80% beds of the private hospitals. After a long wrangling with the private hospitals, the state has managed to convince them and the private hospitals will now be handing over their beds to the state to augment its health facilities, and this will also happen sometime during the next week. So this will significantly increase the number of beds. Meanwhile, the Maharashtra government is also mulling whether they can go through with a lockdown relaxation after the 31st. They are waiting, of course, for the centre to decide whether or not the lockdown will be relaxed. We are hearing from the centre that there could be a further 15 days extension of the lockdown, but Maharashtra is trying to see if there are any ways to provide some relaxations, especially because the industry is suffering the highest, and Maharashtra is the biggest industrial state in the country and contributes significantly to the GDP of the country. So the economy of Maharashtra getting back on track is very, very important, and most importantly the economy of Mumbai, because Mumbai is the financial hub of the country and it contributes a lot to the taxes and the GDP of the country. Now the government has decided that there will be a phase-wise relaxation of the lockdown, if at all. But the question is, will this happen before the monsoons or will this happen post June 15th once the monsoon sets in? Because that then will require a different kind of response from the Maharashtra government, especially because the monsoons will compound its problems not just in terms of health facilities but also in terms of civic amenities that they will need to provide. One of the things that the Maharashtra government has been requesting time and again, of course, is whether the local trains can be restarted. But the problem with the local trains restarting is, will social distancing be possible to maintain in the way the locals run right now? Will there be proper monitoring of all these things once the locals start? Because as of now, the railways do not seem very confident about being able to provide a particular person at every platform, at every coach, to see whether or not social distancing is maintained. The other aspect, of course, is whether private offices will be started in the red zones, and shops and salons, will they be started in the red zones? All of this is right now under the consideration of the Maharashtra government, which hasn't really come up with an exit plan. The Chief Secretary and the Chief Minister are said to be not in favor of lifting the lockdown in a hurry. They want to be able to augment the entire health facilities and also see to it that it is done in a phased manner so that the spike in infections can be controlled.